Hello and welcome to the Orientation to Ontario podcast series. My name is Sam, and I am so glad you are here with us today. The Orientation to Ontario, or O2O podcasts, are designed to support newcomers as they settle and build their lives in Ontario. Each episode explores a different topic, from housing and healthcare to employment, education, and community connections, giving you practical information and helpful tips. In today's episode, we will give you an overview of healthcare in Ontario. This is very important for newcomers. To help us learn more, I would like to welcome Aisha, a social worker who will explain what you need to know.
Thank you, Sam. Hello, everyone. Today, I will explain how the healthcare system works here in Ontario and what newcomers need to know.
Great. Let's start with something basic. Can you tell us, Aisha, who is responsible for healthcare in Canada?
Sure, Sam. Here is something important to remember. The federal, provincial, and territorial governments all play a role. But in Canada, provincial and territorial governments are responsible for delivering healthcare services, like hospitals and doctors.
What an interesting point. So, what about health card and insurance? How do newcomers get that in Ontario?
In Ontario, the government provides universal health care through OHIP, which stands for Ontario Health Insurance Plan. This plan pays for basic medical services, like visiting a family doctor or going to the emergency room. As a Canadian citizen or permanent resident, you pay for OHIP through your income taxes.
Did you know that having OHIP is really important?
Yes. To use health services in Ontario, you must have an OHIP card, which is often called your health card. Always bring this card when you see a doctor or go to a hospital. It proves you are eligible for health care in Ontario.
Let's move on to the next point. Does OHIP cover everything?
No, Sam. OHIP doesn't pay for all healthcare needs. For example, dental services and some prescription drugs are not covered. Some employers provide health benefit plans, or you can buy private insurance to cover extra costs.
That's useful to know. So, how can newcomers get their OHIP card?
You should apply as soon as you have the necessary documents. Go to your nearest Service Ontario Centre with your OHIP-eligible immigration document and 2 other pieces of ID. The good news is there is no waiting period now. If you are eligible, you get coverage immediately. I remember a student from Nigeria, Ahmed, who was relieved to learn this. He got his OHIP card the same week he arrived and was able to see a doctor when he caught a bad cold during winter.
This is very useful information. For more details on OHIP, often called your health card, I encourage newcomers to visit our website and explore our digital tools, such as webinars. Now, can I add that there is also special coverage for refugees?
Yes, refugees might get short-term health care through the Interim Federal Health Program. You usually don't need to apply. Coverage depends on your immigration status and is activated automatically.
Can you tell us about OHIP Plus? I heard it helps young people.
Absolutely. OHIP Plus covers more than 5,000 prescription drugs for free for anyone 24 years old or younger who doesn't have a private insurance plan. You don't have to register. Just use your health card number and an eligible prescription. But remember, OHIP Plus stops when you turn 25 or if you get private coverage.
Here is something important to remember. Your family doctor is very important. Can you tell us why?
Sure. Your family doctor is usually the first person you contact if you are sick or need medical advice. They can refer you to a specialist if needed. If you don't have a family doctor, you can use Healthcare Connect website or ask your settlement counselor, friends, or family for recommendations. I worked with a newcomer couple from Colombia who who didn't know they could register for a family doctor. Once they did, they said it made them feel at home because they had someone they could trust for regular care.
Did you know that there are other options if you don't have a family doctor right away?
Yes, you can visit walk-in clinics or community health centers. Community health centers help people who face barriers accessing healthcare, like newcomers or those with low income. Remember, always bring your OHIP card.
And what about emergencies?
If it's life-threatening, dial 911. An ambulance will come with paramedics to help you. You can also go to a hospital emergency room, which is open all day and all night. If you don't have OHIP, you'll have to pay for services.
Can you tell us more about mental health services?
Sure. OHIP covers mental health care provided by psychiatrists. Other services, like psychologists or counselors, are only covered if provided by government-funded agencies, hospitals, or community health centers.
Wow, that's a lot of information. Anything else newcomers should know?
Yes, bring vaccination records for you and your children. Also, if you had a medical examination before arriving, you may need follow-up medical surveillance in Ontario. Contact your local public health unit within 30 days.
Thank you, Aisha. That was very helpful. So, in today's episode, we have covered OHIP, your health card in Ontario, and how it helps you access doctors and hospitals. We also covered OHIP Plus for young people, family doctors, walk-in clinics, community health centers, emergencies, and mental health services.
You're welcome. And remember, for more information about healthcare in Ontario, visit ontario.ca or call the services we mentioned. Stay healthy and don't forget your OHIP card.
And this brings us to the end of today's episode. Thank you for listening to the Orientation to Ontario podcast series. To learn more and to access resources in multiple languages, visit our website and make sure to explore our digital tools, including the webinars, fact sheets, mental health guide, Arrive On app, O2O chatbot, and the First Steps in Canada Planner. The link to our website and all digital resources are shared in the description below. Be sure to listen to more episodes on settlement topics designed to support your journey. Until next time, have a good one, and welcome to Ontario.